morning. Thanks for joining us today for our webinar. My name is Carmen Boone. I'm an education coordinator from Oregon Pacific Area Health Education Center, a hosted agency of Samaritan Lebanon Community Hospital. Our agency mission is to promote access to quality healthcare throughout community and educational partnerships. Today, I will be your host and moderator. Let's go over some housekeeping items. Please mute your microphones and unmute them to answer questions. Use the chat box for comments and the Q&A for questions at any time. This webinar is being recorded and will be available on our YouTube channel. If you have any questions or have trouble downloading slides or accessing the channel, please send me an email. You'll see my email address right there on the screen. To obtain CME or CE credits, contact hours, or a certificate of attendance for this activity, you must log into www.eeds.com and enter this activity code. Please write down the activity code and consider that it expires in 1 week. We will email you the instructions and the link to the webinar YouTube channel tomorrow, and you'll be able to download the slides from the EATS website as well. This presentation is jointly provided by Samaritan Health Services, Oregon AHEC, Oregon Health and Science University, and Oregon Pacific AHEC. The presenters and the planners of this activity report that we have no conflicts of interest or relevant financial relationships with any commercial entities that might affect the contents of this presentation. Doctors Tina Runyan and Joan Fleishman are our presenters today. They are both clinical psychologists with backgrounds in academic medicine and integrated behavioral health. Throughout their work as directors of behavioral health programs in family medicine residencies, they identified a need for better mental health and well-being support for clinicians. In 2020, they founded 10 Health to focus on providing specialized and accessible mental health care to healthcare professionals. 10 Health offers mental health care in 9 states, including Oregon, Washington, and they are passionate about clinician well-being and consult with healthcare organizations to improve well-being and reduce barriers to care. Now, without further ado, I leave you with Tina and Joan.
Thank you so much, Carmen. And good morning, very early morning for all of you. I'm in Massachusetts, so it's a slightly more humane morning for me here, and happy April to everybody as well. We've been bringing you these series of presentations since January, so we have a every 2-week cadence that we've been going on, and so I trust we have some repeat attendees, and it's nice to be entering spring with all of you. So like Carmen said, there is a chat function. And so as we, if we are engaging in any sort of dialogue, so to speak, please use the chat function. There's also the question for the Q&A button for questions that we could address either throughout the webinar or at the end of the presentation, but please feel free to use the chat function. And we'd love to start by just hearing a little bit, if you're willing, if you're already at your computer and sitting down and engaged, to tell us who you are and where you're from, what work you're doing and where you're from. We love to just get a sense of who's here with us in the presentation. So feel free to chat that in if you're willing. And I am going to, good morning, Lois. Thanks for starting us off. And Christina, I'm gonna share my screen and still be able to access the chat. Okay. So thanks again, Carmen, and to Oregon AHEC for this opportunity to come and speak with you all this morning. We're going to be talking about an introduction to mindfulness as it applies to clinical practice. So there's lots of ways that mindfulness is out in the mainstream media and lots of apps that you can engage in for learning and practicing mindfulness. And my hope today is to bring some curiosity and some encouragement to think about the application of mindfulness as it pertains to your work, and not something that you do before work or after work or instead of work, but that you actually are able to bring this and make it, infuse it with the work that you do. So here is just a quick look at the series that we are starting on now. We are in our second series. We completed our first series of 3 didactics and 3 practice labs. And the second series has an intentional focus on mindful practice and communication. So we're in the first of that series this morning, this introduction to mindfulness and clinical practice. In 2 weeks, we will have a practice lab where we will do less blah, 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 and more engaging through this Zoom format in using some of these skills in practice. And then we're going to transition to a focus on leadership and looking at mindful and compassionate leadership in May. And we'll complete the series in June, wrapping up with using these same skills and principles around specifically communication and managing difficult conversations. And as Carmen said, we don't have any express conflict of interest that would impact or in any way influence the content of this presentation. We are from Tend Health. We're not selling you anything today. We're just here to be with you to provide some education and hopefully some momentum and motivation. But the work that we do is providing mental health care and well-being services to individuals and organizations. I'm so grateful for everybody signing into the chat and letting us know who's here and letting one another know who is here. It's really lovely to be able to get a sense of the kind of work that people are doing at this time and where you're joining us from. And Velda from Alaska, we were just talking about Alaska. So I'm not sure what got you up so early. I'm deeply grateful and honored if it was this presentation that got you up so early, Velda. Welcome, and I hope you have a cup of coffee or tea in hand, whatever your particular vice to maintain you during this next hour. So what we're going to be focusing on is defining mindfulness and its utility, like I said, in clinical practice. And I use that while I often will talk about medicine, I use that term clinical practice very broadly in terms of whatever specific practice you're doing in the healthcare space. We're going to look at a little bit of the evidence for the practice of mindfulness and invite a couple of concrete and manageable practices around mindfulness that you can do during your day. And what I'd love you to leave with is an intention to try to do one of those 1 or 2 times a day, right? So that the prescription, if you will, for the end of the presentation is to think about doing 1 to 2 minutes, and then increase that frequency or duration as tolerated. That's the hopeful prescription at the end of the presentation. So, yeah, to start. This is a well-known quote by William Osler, and there's lots of quotes like this. Yogi Bear has one about you can see a lot by just watching or something like that. And this one is very specific to medicine. So we miss more by not seeing than not knowing. And that's really the frame of this presentation, because we do so much in this space, including what we're doing today, right? We're doing our continuing medical education, and we do a lot to learn about knowledge and things that we can sort of plug into our database hopefully that we can pull out as and when relevant, to expand our knowledge, to expand our procedural skills or our technical skills. So we do a lot in that space as clinicians. And I'm going to be talking about a different kind of training for the mind. And my hope is that you actually see it as important as this other kind of continuing medical education that is very knowledge-based and fact-based. And this kind of training of the mind is something quite different and yet equally important. So when I say training for the mind through mindfulness, I'll start with what I mean definitionally by mindfulness, because there's a lot of definitions that are out there. So here's basically a classic scientific definition of mindfulness with a slight adjustment that I will own, and you can adopt it if it fits for you, and you can use the classic one if that works better. But mindfulness is the awareness that emerges from paying attention on purpose. So purposely paying attention. And the textbook definition is without judgment, non-judgmentally. And I actually like to offer a way to pay attention rather than a way not to pay attention, because one, this judgment comes so naturally for all of us as humans, and particularly as healthcare professionals. That is a very well developed muscle of judgment. And then we can get judgy about our judgment. Oh, I'm not supposed to be judging. And here I am judging. Now I'm going to judge the fact that I'm judging, that I'm judging. So I actually like to replace it, much as you would if you're training a dog or you're sort of working with a toddler. Instead of just saying, stop doing this, you reorient them to say, like, let's do this instead, right? You give them something to do rather than something not to do. And mindfulness really does imbue that quality of kindness and compassion. So I like to say it's the awareness that emerges from paying attention on purpose with compassion to things exactly as they are, even if they are not how we want them to be. That's not part of the definition, but that's the idea, is how do we pay attention to things exactly as they are right now with the spirit of compassion? That's what I mean by mindfulness. And the reason attention is part of this, and attention is actually a very critical part of this, and perhaps we're at a time in our lives right now, culturally, where being able to pay attention in a particular way is under threat, really. There's many ways in which our technology and our devices and the pace of our lives are pretty aggressively dismantling our ability to pay attention. And there's lots of places where attention is getting monetized, in fact. So there's very pernicious attacks on our attention. And so this ability to cultivate paying attention in the moment on purpose is crucial, not just to one's well-being, but certainly in one's work. So there are two types of attention that we all have, and you can think of these in different titles. So I'm going to talk about them as top down and bottom up. Daniel Kahneman, Nobel Prize winning psychologist, will talk about them as type 1 and type 2 kinds of thinking. But top down is this kind of attention that comes from having a lot of information and knowledge and structure, kind of having a scaffolding, particularly with our work. Again, I'm talking about in our minds. We have what we expect based on the information we have, how we categorize information that's coming to us. Does it fit this profile? No. This one, no. Yeah. Oh, it fits this profile. Okay. And it begins to also organize the questions that we ask. So whether it's working through a decision tree or algorithm that's offered to you from a piece of technology, we all have that internal algorithm that happens for ourselves and is in many ways necessary in the work that we do when we're trying to do differential diagnoses. We're trying to determine whether this approach to care is going to be better than that approach to care based on what we're seeing in front of us. So we all do that, and we do it multiple times a day with our work. It's a very purposeful Some of it may be outside of your awareness because it's so routine, because you've done it so many times, which is both really useful and can make you very efficient, because our brain is so primed to pick up on patterns and identify and categorize things. And yet there's also risks associated with this, because when we get too focused on top-down attention, this bottom-up attention can be compromised. So bottom-up attention are the things that are outside of that very cognitive process. So things that are startling, right? Even if you are paying attention very intensely, if there is a loud noise, or you identify something in your peripheral vision that is squiggly and moving quickly, right, in the corner of your eye, that is going to hijack your attention and cause you to pay attention. So startling things will do that. There's often not as many of those in our clinical work, however. So sometimes things that we are not expecting and perhaps should startle us in a way, should trigger our attention, won't if our guardrails are up too high and we're so focused on top-down attention. We actually won't pay attention to things that should catch our attention, that should be red flags. So the very obvious ones, right, in a clinical encounter, if you're a mental health clinician, somebody mentioning something about self-harm is a startling thing and will catch your attention. But there's lots of more subtle things, right? Or if in the medical space, somebody, an elderly gentleman with a history of hypertension who makes a comment about chest pain is going to hijack your attention. That is a startling thing, if you will, akin to a rope-like structure squiggling in the corner that your brain perceives as a snake, or a loud noise. So there are those things, but then there's other things that are more subtle, that if our attentional focus is too top down, our bottom-up attention won't be sufficient to actually register these. And this is where there can be, when people go back and sort of unpack, right, clinical encounters or conversations, this is where that's place of like, oh, I should have registered that. I should have picked up on that. But when we're so top down, we often miss it. And that's just true for all of us as humans. And so being able to cultivate and make space for this bottom up attention is part of what is on offer with the practice of mindfulness, because it has this capacity of spaciousness and opening us up, if you will, to allow this other way of knowing, intuition, sort of master clinician type things, to be able to be present, right? If you ask people sometimes who you might consider very masterful in your particular craft, how did you know that? How did you know to ask that? They may not even be able to articulate how they knew that, because it's not coming from the algorithm. It's not coming top down from, I learned it by asking these series of questions, and if I get this answer, then this is the next question. They're not going to be able to categorize it in that way, because it's coming from that bottom up place. It's coming from another way of knowing, if you will. And I will invite you, I can see the chat simultaneously. I can't see the questions, but I can see the chat. So if you have a comment, a question that might be more appropriate for the end, please put that in the Q&A, but and then Joan or Carmen can cue me for that. But if you have a comment or a reflection, feel free to put that in the chat. I can simultaneously see that as we go. So I hope that's providing some frame for thinking about why cultivating mindfulness as a clinical tool actually could be very beneficial to you outside of the offer around kind of your own well-being, but as a clinician, what's on offer. And so mindfulness is really this wedge of awareness, if you will, where we constantly are processing so much stimuli. And I'm thinking about this again in your work setting. You are processing things that you're taking in visually about your patient, You're processing things that you are hearing. You're processing through all of your senses. If you are in a specialty where you have hands-on, you're processing tactile information through your physical examination. You're taking in all this stimuli, and there can be, because of pattern recognition, because of history of doing things, right? We can go very linear. And so mindfulness is this wedge of awareness that allows us to move from this place of stimulus response, stimulus reaction into kind of a little bit more of a discerning way to respond to stimuli that's coming in. So with mindfulness, not only are we becoming aware of what's outside of us in terms of our patient, but we also can become aware of our own internal thoughts, our own internal judgments, biases, the way our previous experiences might be informing how we are engaging in this particular encounter. And we can also begin to be aware of our internal emotional state and our internal body sensations. And our bodies are often very quick and sensitive sources of data to give us information about how we are in this particular encounter, right? We probably have particular postures when we feel very pressed for time or rushed. We might cut off conversation or feel frustrated if somebody is going on, and you asked a closed-end question and they have provided you with a soliloquy of an open-ended answer, if you will. We can begin to notice that, impatience is here, frustration is here. And when we can begin to notice what's happening inside of ourselves, it gives us that opportunity to pause so that we can, instead of being reactive to our impatience, which patients can pick up on, we can be responsive to our own impatience, and we can be responsive in a way that is very sort of gracious and generous, if you will, for our patients. So I have not used the word meditation yet. And oftentimes mindfulness and meditation get conflated or get used together in the same, as if they're the same thing. And so I want to make a distinction here, because meditation, you can practice mindful meditation as a formal practice, and mindfulness meditation is a formal type of practice. But I want to give you a frame for how I think about this related to the sense of mindfulness in clinical practice. So meditation, all types of meditation, can be a very useful tool to build your attentional capacity. And so that is why a lot of meditations have a concentration focus at their core. And so it might be a meditation where you are really focusing on your breath, for example, and you notice other things that come in, and then you come back to the breath. Or you're doing that within the body for a body scan, for example. Thoughts come in, emotions come in, other sensations. You're focusing on the right foot, but then all of a sudden you notice the left knee and you come back to the right foot. Those are concentration practices in meditation, and they're incredibly useful for building this capacity of mindfulness. They are not altogether necessary. I would say there's probably some debate of whether you need some formal and concentration practices to build your capacity for mindfulness. But ultimately, none of those practices are really in service of becoming a great meditator. Except for a very few people who choose that as their vocation, right? For most people, it is not how you are spending your days. So we're not trying to just become a great meditator. We are trying to use that as basically that repetition for your mind to build the capacity for mindfulness. And that mindfulness in that way is a very informal, if you will, way of being that allows you to be in service of this greater awareness. ultimately the goal is to just be in awareness of all of what's happening around you through your senses and all that's happening inside of you. So we're really building this capacity to have present moment awareness externally and internally, and to bring that into our clinical practice. And so the meditations that are often used as mindfulness meditation are really in service to this way of being in terms of mindfulness. And there are other ways you can cultivate that. You can cultivate it really by just practicing present moment awareness, not as a formal meditation, but as a way of being. So I hope that is clear. I welcome any questions about that distinction, why I'm not having specifically used the word meditation when I'm talking about mindfulness. So if somebody could offer you these things in pill form, we like our medications in the US, right? If somebody could offer you this, and when I'm talking with people in person, I often have people sort of go through the list and see, raise your hand at which point you would take this pill. If you had a pill that would offer you increased self-awareness and self-acceptance, would you take that pill? Greater capacity to be present with suffering and manage difficult situations, would you take that pill? Enhanced relationships with patients, better self-care, greater sense of connectedness with your colleagues and with teams, decreased levels of stress, anxiety, and depression, greater job satisfaction and sense of purpose, and enhanced effectiveness. I'm guessing that almost all of us at some point down this list would have raised our hands, that would be the threshold at which we would say, yeah, we'll take this pill every day. And this is really what's on offer for the practice of mindfulness, and specifically the practice of mindfulness in your clinical practice. This is what's on offer. And this is sort of data-driven effectiveness about what happens with mindfulness practice. Now, most of the research that has looked at the benefits of mindfulness have done so using the mindfulness-based stress reduction curriculum, if you will. So over 40 years ago, John Kabat-Zinn out of the University of Massachusetts developed this mindfulness-based stress reduction curriculum. He had his own practice as a Buddhist and used insight-oriented meditation practices and made this transition of those practices in a secular format. So sort of as much as you could strip them of their religious or spiritual underpinnings, and just went to the praxis of the meditations and packaged them in this 8-week curriculum that is 8 weeks, 2.5 hours a session over 8 weeks, with essentially an all-day session of silent meditation, all day being sort of like 9 to 4. So most of the research that has been looking at the effectiveness of mindfulness, unless it talks about a modification of that curriculum, have been done with research participants, randomizing them to that particular intervention, if you will. There's a lot of spin-offs of that, but I like people to know that that's the dose where we're starting to see these effects of training. And I think that's important to say, because a lot of times, there's a lot of evidence touted about the effect of mindfulness or the benefits of mindfulness or the benefits of mindfulness meditation. And, really, we don't fully know what is the benefit of somebody doing this, a formal practice, 2 minutes a day for 8 weeks. I don't think we have that data yet. Or somebody not doing a formal practice, but really infusing everything they do with mindfulness and presence. We actually don't have a lot of data on that yet either. Not to say that they're not effective, but I like people to know that the dose that we're talking about, it actually has some intensity to it in terms of the amount of hours, if you will, that people are putting into these practices. So the curriculum, again, 8 weeks, 2.5 hours, with about an hour of practice each day in between those things. So over a course of 8 weeks, I should do the math, but I haven't done the math to see about how many hours that is. But that's the source of what's happening for the intervention. And what the studies are showing, I'm going to show you a couple, that there's structural changes in the amygdala on functional MRI. And the reason that's important is because you all probably know, and if you were at any of our one of our earlier sessions, we talked a lot about the neuroscience of the stress response in the amygdala. And our amygdala is our threat detection center. It is always active and alert, and it is constantly scanning your external and internal world for potential threats. And it is the source of the activation of your stress response and also the activation of aggression. And so to have some structural changes in the amygdala is actually really significant, related to dampening the threat detection center. And don't worry, it doesn't dampen it to the point where it doesn't go off where it needs to. Because most of us have a pretty active, if not overactive, amygdala, and particularly if you've had some earlier experiences that have been traumatic, your amygdala might be particularly sensitized. So to see those structural changes with that level of practice is pretty significant. But even more fascinating is what's shown in other parts of the brain. So again, with this 8-week dose, if you will, this is a systematic review showing not just changes in activity, but changes in connectivity in certain parts of the brain. And the reason this is so compelling is because you have changes in these areas. Our prefrontal cortex, our thinking part of our brain, that can always help us sort out the meaning of our amygdala going off. It can always help us sort out, is this a real threat or not? So to have some changes in the capacity of your prefrontal cortex to make sense of the noise. The cingulate cortex, particularly the anterior cingulate cortex, the ACC, that's a part of your brain that is really involved with the limbic system and your affect regulation. The insula is part of your brain that's really involved in self-awareness. There's still some debate about kind of all the things that each of these brain structures do as we continue to learn, but essentially it's around self-awareness. And then the hippocampus is very involved with memory. So you have this cluster of brain structures that are intimately involved in interpreting stimuli, understanding that for oneself, regulating that, and then forming a memory around that so that you can use going forward into the future. So to have those changes in the brain with this level of intervention around those key features, one, these are all the things that mindfulness meditation practice is leveraging and working on. So on one hand, it's not that surprising, but to be able to see these from a neuroscience perspective, to have the sensitivity in our measurement to be able to detect those is pretty phenomenal. And to see that when I said the list of these are the things that are on offer, it's because you're actually getting these volume and connection and activity changes within your brain that allows those things to be revealed, to be manifested in terms of that list of increased self-awareness, better sense of effectiveness, greater satisfaction, a lot more job satisfaction. And then the other thing is the way that those structures interact with the amygdala has been shown. So you get decreased functional activity in the amygdala. It's not as ornery, it's not as sensitive, and improved functional connectivity. So the way the amygdala shoots information to the other parts of your brain that are going to make sense of the threat is actually enhanced. That can happen quicker and more easily so that you can leverage the parts of your brain that can help you interpret, is this something to be that I need to continue to be activated about, or is this something I can actually say, well, actually that's a rope, not a snake in the corner of the office, and begin to quiet down internally. I'm not seeing any comments in the chat, but again, I welcome those if anybody has any. And I don't know, I'm going to pause there actually before I go on, and just because I can't see the Q&A to see if there's any questions right now coming up in the Q&A.
We don't have questions so far.
Okay. So how does this, so all that hopefully sounds good and you're interested and motivated. How does this play out in terms of your clinical work? And so there's 4 key areas when we think about applying mindfulness to our clinical work in terms of both attitudes and intentions. And so the first I've really talked about, which is attentive observation. And that has to do with cultivating more of that bottom-up way of knowing. That's not just reactive, but that is available essentially in your clinical encounters. The second one is about critical and discerning curiosity. And that may take the form of something like, what am I missing? But it can also take the form of recognizing that there are aspects of medicine that inherently constrain our curiosity. And we begin to adopt to those because we're seemingly meeting higher order expectations. So I will point everybody to a beautiful essay actually written over 20 years ago by Faith Fitzgerald, and it's entitled Curiosity is the name of the essay, and it's in the Annals of Internal Medicine, and it's entitled Curiosity. And she talks about some of these things that constrain our curiosity in medicine, and even 20 years ago, talking about, efficiency really threatening our curiosity in medicine. What's written down in the electronic record as really threatening our curiosity in medicine. She has a little anecdote in her essay in which she says a senior resident once presented a patient in morning report, and as part of the physical examination mentioned a scar in the patient's groin. When I asked how the scar had been acquired, she said, "He told me he was bitten by a snake." "How did that happen?" I asked. "Oh, I don't know." And she goes on to say, how could that be? How could somebody not ask anymore after that kind of presentation? She also goes on to say about a presentation from a trainee who said that the patient had BKA, below the knee amputation, ×2. She comes to the bedside and she clearly saw that the patient had legs. And she said, well, how can you say he had bilateral below the knee amputations? And the student was confused and could not understand the question and was struck mute. He reached out and touched the legs, warm, hairy, clearly the patient's own and not prosthetics. What made you think he had bilateral below the knee amputations? It said so in the chart. And what had happened is somebody had miswritten DKA as BKA, and it just became, right, it became forevermore that this patient had below the knee amputations. So the essay has several of those examples, but suffice it to say, even 20 years ago, talking about how sometimes looking at the chart, what's there before you, and this pressure that we feel in terms of efficiency have an unintended, perhaps intended, but I think largely an unintended consequence of constraining curiosity. And so a mindfulness practice in your clinical practice reinvigorates that sense of curiosity, to not sort of trust what is written down as truth or as truth in this moment. It also begins to cultivate a sense of beginner's mind. Really, it's that sense of being open, being willing to be surprised, being willing to allow your intuition to guide you, not just the algorithm. And finally, this quality of presence. So when we talk about mindfulness in clinical practice, it's really those elements that, that we're referring to. And so I'll point you to another study on mindfulness and mindful communication. So this was the 70 primary care physicians, and it was the same structure, 8 weeks, 2.5 hours a week, and a 1 all-day retreat. And then they did have a maintenance phase where they met once a month for 2.5 hours. So a pretty intensive intervention, if you will, that was based on mindfulness meditation, these exercises to cultivate beginner's mind, curiosity, attention, presence, all with clinicians. And so this is really what they focused on with this mindful practice, is really attention in a non-judgmental way. I would rephrase that as this is where I would, anytime you see non-judgment, I would replace it with compassion. So understanding, that mindlessness can account for some of these deviations in our errors in judgment or technique, that our biases, when unexamined, can show up in ways that are really can be quite harmful in our clinical practice. And trying to really emphasize relationship-centered care. And what they found was changes, because of the mindfulness practice, changes in total mood disturbance among the clinicians. These were not people who were selected because they had a mood disorder, but they found this as well. Increased perspective taking on the subscale of physician empathy, decrease in burnout, and some shifts in some personality factors around conscientiousness and emotional stability. And so thinking back to the neuroscience, right, that actually tracks and makes a lot of sense. If you're getting some of those changes in the parts of your brain, the insula and the ACC that are really involved with affect regulation, with self-awareness and affect regulation, you can see how those findings make a lot of sense. So, and there have since been several other studies. One of the things that tends to happen in this space is, like, if we can get really good outcomes at this level of intensity, how much can we dilute it and get the same level of effect? So a lot of the research sort of tends towards that. And so all I can say is that, the intensive interventions that do require a fair amount of commitment and buy-in and practice consistently seem to show these effects. So as a clinician, mindfulness is not the same as meditation. Meditation is the tool, but it's not the same. And I also want to make a distinction, because sometimes people say, oh, I use my mindfulness, I go to a happy place, in my mind, or I go and I pretend that I'm, if this patient's really annoying me, I just pretend that I'm sitting on my favorite beach, or I'm on top of my favorite mountain. Those are not the same. That's actually the antithesis of mindfulness, if you will. It can be a very effective relaxation strategy, that imagery, but it's not mindfulness, because mindfulness is about really allowing, those things to sort of drop away, and to bring your full attention, your full presence, mind, body, spirit, to the present moment, even if it's unpleasant. Maybe especially if it's unpleasant. And so I don't mean to say that those aren't useful. It's just mindfulness is being fully present, bringing that awareness with compassion to things just as they are, including being with the person, your favorite person to be with in your work, and all the way to the person that you sigh about when you see them on your schedule for the day. Through that whole continuum, bringing your full presence and your full awareness. And I like to think about, when I say meditation is the tool, I actually don't think about it as a tool like a hammer tool. I think about it much more like a stud finder. A stud finder is a tool that is just alerting you to what's already there, right? As you do the stud finder along the wall, and it's like, oh, here's a piece of wood that has much more density than other pieces. Here's where the stud is. It's just revealing to you what's already there. And mindfulness and meditation practice is very much like that. It's just clearing away some of the dust, clearing away some of the constraints that we have learned along the way that may have been helpful at one time and may no longer serve us. It's clearing those away and just revealing what's already your internal true nature and your internal true wisdom to be with yourself and to be with others in the world. That's really that sense of presence. So a couple of strategies of just how do you do this if you don't have time to meditate, and particularly if you don't have time in the middle of your clinic day. So this is a very accessible practice that you can use multiple times a day. And it really fits in this space of mindfulness. So it's just stopping, like stopping what you're doing and what you are becoming while you are doing it, to come out of whatever is automatic pilot, rushing around, doing whatever, to just pause, to take a couple of mindful breaths so that you're breathing, knowing you are breathing, to do like a little check-in. How are things in my head? Is it cluttered up there? Is it frenetic? Is it calm? How are things in my heart? Am I feeling tight? Am I feeling pressured? How are things in my body? So this very quick, like 3-point check. And then to proceed. And it's not that it has to change. It might be that you are really feeling pressure and your shoulders are reaching up towards your ears because you're late, or you're running late and people are getting frustrated in your clinic, or somebody's expecting something from you at home and you have these other things that are demanding your attention. And so it may be that there really is tension there, and that's what you're noticing. A couple of breaths may help to bring some of that down or recognize the thoughts that might be perpetuating that. It doesn't mean to change that necessarily. It's just, oh, there's a lot of tension here right now. Okay, a lot of tension. And then move on. So really just bringing a stop sign into your day a couple of times a day. And then if you are feeling particularly stressed, breath techniques are one of the quickest, most accessible, intrinsically available to you. And we're going to be practicing these in our practice lab. So really encourage you to come back for the practice lab, because we're going to be practicing these different breath techniques together and seeing, what you notice in your body. So if you are doing this check-in and you're like, oh, there's a lot of tension here, any one of these breath techniques, and you can certainly Google them, but we will be reviewing them in the practice lab too for stress relief. And that's, again, not necessarily a mindfulness practice, if you will, but you can do all of these breath techniques very mindfully. So they're not necessarily, again, making that distinction of meditation as this concentration tool that we're using to cultivate mindfulness, that we're using to cultivate awareness, but you can do any of these practices very mindfully. So there's cardiac breathing for cardiac coherence, which is an easy way to regulate your heart rate and to activate your parasympathetic nervous system. Belly breathing or diaphragmatic breathing. Box breathing, which is a practice of inhaling, holding, exhaling, holding. And alternate nostril breathing. And so if anyone has gone to a yoga class, you may have experienced alternate nostril breathing. This one may be a little harder to do if you're just scurrying about in your clinic or in the hospital without somebody saying, what are you doing? But it's also accessible to you with no special props and no special equipment. So we will be practicing those. Some of you may be familiar with those, but we will be practicing them in the practice lab. And I want to make sure we leave some time for questions and dialogue, but probably if I had to say, the most magical mindfulness practice as a clinician that I could encourage you to try would be this. At least for some period of time, with every patient you encounter, without your agenda, without your expectations, without your rush to get things wrapped up, which are understandably all there. Just for a few minutes, place an empty cup of attention between you and your patient and see what emerges. And that in and of itself is, the number one mindfulness practice that I could encourage you to do as a clinician, and is indeed a mindfulness practice, is you're laying down all that you came in with and just offering your full presence for some period of time with your patients. I'm going to stop my screen sharing. Actually, I'm not going to stop my screen sharing. Yeah, I am stopping my screen sharing here. And then I would welcome if there's, I think now I can see the questions. I don't see any questions, but would welcome any questions or comments that people may have about what you've heard, about its application. I know Joan has a question.
Can unmute, yes. They can unmute.
They can unmute.
Yeah, so if anyone wants to just ask a question or as a comment or reflection, you can put it in the chat, you can put it in the Q&A, you can unmute. We're a friendly bunch.
Yes.
And I certainly, I want to go back to something you said much earlier. Could you help us define the difference between mindfulness and meditation again?
Mm-hmm. Yeah, so meditation is a formal practice. There's various types of meditation. So meditation is not even one thing. There's transcendental meditation and insight-oriented meditation and loving kindness meditation. So there's actually a whole panoply of different types of meditation. And that is always a formal practice, if you will. Meditation is always going to be a formal practice. It might be, your posture may be laying down, your posture might be sitting, your posture might be walking, if walking meditation, but it's always a formal practice with a particular type of instruction around paying attention, often to an object of concentration. There is kind of an open awareness meditation where you're not doing that. But if you're doing walking meditation, for example, your focus of concentration is really on walking. And every time your thoughts or your emotions come in, you are returning your focus, your attention, if you will, to your foot on the floor, your foot lifting off the floor, your body propelling slightly in space. So meditation always has a formality to it around a practice. Mindfulness is actually a type of meditation as well, but when I'm talking about it here, I'm talking about it much more as a way of being, and specifically about your attention. So it's paying attention in a particular way to things just as they are. And when you are doing that repeatedly, and you can do that repeatedly, what happens is awareness emerges. So I like to think of it sort of in those three, in that scaffolding, sort of, that meditation are these formal practices to help cultivate a sense of mindfulness, but it's all in the spirit of trying to allow awareness to emerge. I hope that helps.
Yes, thanks.
Jolene got her sound back good. Any other questions? Even questions around how challenging this may be.
I don't see questions, but while our attendees are thinking and typing, I could go over things to remember and keep in mind. All right. Remember, we will email you the CME instructions and the YouTube link. Sorry, on the slide it says today, but it'll be tomorrow. Also, please claim your certificate, and that way you'll be able to complete the program evaluation. You'll also be able to download the slides for today, and it'll just take a moment and it'll help us a lot. The activity code expires in 1 week. Also, remember the webinar is being recorded, and we'll send you the link of the YouTube channel. Feel free to reach out to me or our office if you have any questions or concerns. We'll be happy to be of assistance. And after this webinar, again, tomorrow, you'll receive an email. Now, these are the following topics and dates. And so it's on the flyer and invitation that you received as well. And just, we have really interesting topics and things to learn in the following weeks. Now, just once more, the activity codes is here. And let's see if we have questions.
Just the PowerPoint slides. Yeah.
Yeah. So I can email the PowerPoint slides. Please send me an email and requesting them, and I'll be able to do so. Right now, we have set it up so you all can access the slides once you get into EATS, and you can download them from there at any time. And yeah, thank you for your question, and thank you for participating. See, anybody has another question?
I just added to the chat the article that I mentioned in case anyone didn't get it. It's Curiosity by Faith Fitzgerald, 1999.
All right. I don't see other questions. I can add also the slides to the chat. So let's see. Okay, any questions? I don't see, I think every point that we tried to today.
Encourage questions, yeah. Well, yeah, mull on it and come to the practice lab with all your questions.
Yeah, yes, please. They are looking forward for next time. We're getting thanks and kudos. So thanks for being there and sharing your morning with us. Yes. And we hope you have a wonderful day today. Thanks, Dina. Thanks, Joan, for sharing our knowledge and helping us with your wonderful information and your kindness. And thanks you all for participating today. And you have now completed the session and you may disconnect. Have a wonderful day, everybody.
Be well. Bye.
Bye.